So this is going to be your video over 7.3 and following. We'll see how far we get with it. Um, so switching over now so we can get started. I'm sorry, 8.3. So 8.3 is just a list of precautions. They're pretty straightforward. I'm not going to go over each of them with you, but make sure you read this list of precautions and contraindications when dealing with people with shoulder injuries, because you will need to not necessarily have this list memorized, but have it like down as a concept of things that you need to be careful with when dealing with the shoulder. One of those being, remember, thumb goes up and towards the body as you come up when you're doing either flexion, abduction, or scaption type exercises. All right, moving on. So this is just about different treatment options, right? Um, Once again, I've provided videos of some treatment options. I've got your MMT cheat sheet that will be coming up here in a little bit that we've gone over some, and I'm going to make a video over as well. But here are just some, and you've got Physio U, but Codman's exercises or pendulum exercises are a very good beginning um, exercise for shoulders. This is a passive range of motion exercise when patients are in very early stages. It doesn't strengthen, it doesn't even really stretch. The only time you really need to use it is when a patient is not allowed to move their arm and you're wanting to still keep the joint um, like moving, right? And so this is a way to do very gentle passive range of motion. So what you have the patient do is stand at like the parallel bars or at the edge of a table plinth right here and stabilize themselves with their unaffected arm and have their affected arm just dangling, right? And the key here is they're not allowed to actually move their shoulder on their own. What they do is move their whole body to where the shoulder just kind of like hangs there like an elephant trunk, right? So the affected arm, then you just let it hang down loosely, and then you can go back and forth and side to side and even in circles to get that shoulder joint still moving and get the fluids going in there and get the blood flow going in there, but without running the risk of injury or inflammation, really. Another very good beginning exercise, like you guys have seen and we've talked about, are isometrics. Once they're able to start kind of a little more actively moving the shoulder, so this is further along in that these are kind of phase 2 exercises here. You can have patients do what are called wall climbs, right? So they can just slowly kind of try and get their arm higher up the wall each time. You can do it forward for flexion or to the side for abduction. They even make these little ladders to where you just kind of have them crawl their finger up the ladder to where they try and get higher each time. Scaption exercises. Um, it's just a way to work both abductors and flexors at the same time. They're a more functional position than just straight flexion or straight abduction because we tend to do more scaption in real life. If you do have them do scaption exercises, these are definitely, if you're doing them against gravity at least, these are definitely higher level exercises that you would be doing in phase 2 or phase 3. And obviously with somebody that has either 3 or 3 plus type 4 strength, okay? Overhead pulleys. These are good exercises for active assistive range of motion. What you do is, and they're hard to see, I'll actually do a short video where I go over some of these exercises with you and I'll put it here. But I'll show you. But the key is it literally is just a rope with handles and it's on a pulley up here. And so what you're having the patient do is use the other arm that's not affected by the surgery or the injury to help pull the affected arm into further range of motion. Now, you can either have them just go back and forth, up and down, to where it's active assistive range of motion, or you can combine a stretch with that where they pull it down to where they get into that new range of motion, and then they hold it for 15 to 60 seconds, or even longer if they can tolerate it. So I will demonstrate, especially the pulleys for you. A body blade is this, they're kind of like shake weights actually, and I'll show you guys this too, but you can hold it with one or two hands and you just kind of shake it back and forth. It's very good for strengthening those postural type muscle fibers, and for more endurance type training for patients who need to just kind of stabilize joints or improve overall endurance. And so you can have them do just about any activity while they wrap their hands around this handle in the middle and they just kind of shake this back and forth um, while they do it. So here's a video. Please, please, please make sure you watch this video, your PNF strengthening techniques, because they're massively important in understanding things. So these will go over each of those PNF techniques, but more importantly, this video, I show you each of them. So make sure you understand these PNF strengthening techniques and that you're practicing them, okay? I'm not gonna go over each of these because I really have, right? There are ways to modify different exercises, right? You can, like, instead of just doing a push-up, you can do a wall push-up. Um, you can do push-up on an incline, which makes it even harder. You can do knee push-ups with the knees bent, which also can kind of make it harder. Or if you really want to really make it hard, have them try and do it when they're on some sort of unstable surface. So anyways, and here's just a little exercise to kind of help you with that. I'm going to stop. Well, let's look and see what's next. Oh, I'm not going to go over this. This is just an actual PT's eval of somebody who has a shoulder condition, adhesive capsulitis, and it just kind of walks through what an eval would look like and the different goals that the therapist has set. And so it kind of gives you an idea of what you might see, except nowadays they would all be typed out. You'll hardly ever see a handwritten eval anymore. So that's the information from Unit 8. I know there's a lot of stuff here, and this is where the class starts getting a little more like you got to start practicing and doing stuff. So if you have any questions, please ask me, okay? And this is your Therex cheat sheet, and I will do a video over this separately. All right.